Hi friends, in this topic of general examination, today I will talk about the peripheral pulses. Where do we examine these peripheral pulses? First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment, and information provided by this channel is for educational purpose only, and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention and treatment of medical illnesses. There is no endorsement for any brand or a company. A peripheral pulse, it refers to the palpation of the high pressure wave of blood moving away from the heart through the vessel in the extremities following the systolic ejection, and this phenomena is often radially palpated, and it serves as a useful clinical tool comprising one of the most commonly performed physical examination maneuver at every level of medical care. The peripheral pulses are felt at radial artery, carotid artery, brachial artery, femoral, popliteal, posterior tibial and dorsalis pedes arteries, and these peripheral pulses can help us identifying different types of pathologies and by evaluating the rate, rhythm, intensity, and symmetry of the pulses. Coming to the palpation of the carotid pulse, we have to ask the patient to relax the neck. We can palpate the right carotid artery by placing our left thumb near the upper neck between the sternomastoid and trachea, roughly at the level of cricoid cartilage, and note the character of the pulse. We can repeat the procedure on other side by placing your or our right thumb over the patient's left carotid, but we have to ensure that we should not compress the carotid sinus. It is advisable to auscultate the carotid buoy prior to palpation and to prevent possible dislodgement of atherosclerotic plaque. Coming to palpation of brachial pulse, to examine the brachial artery in the right arm, the examiner support the patient's forearm in his left hand. Then patient's upper arm abducted, the elbow slightly flexed, and the forearm externally rotated. The examiner right hand is up, then curled over the anterior aspect of the elbow to palpate along the course of the artery just medial to the biceps tendon and lateral to medial epicondyle of the humerus. The position of the hand should be switched when examining the opposite limb. How do we palpate abdominal aorta? The abdominal aorta is best palpated by applying firm pressure with flattened fingers of hands both hands to indent the epigastric region towards the vertebral column. For this examination, it is essential that the patient's abdominal muscle should be completely relaxed, and such relaxation is achieved by asking him to flex the hips and by providing a pillow to support the head. In extremely obese individuals or those with massive musculature, abdominal musculature, it may be impossible to detect the aortic pulsation. Palpation of the common femoral artery. The common femoral artery, as we know, it emerges from the upper thigh from beneath the inguinal ligament, 1/3 of the distance from the pubis to the anterior superior iliac spine, and it is best palpated with examiner standing on the ipsilateral side of the patient and the fingertips of the examining hands pressed firmly into the groin. How do we palpate the popliteal artery? As we know, popliteal artery passes vertically through the deep portion of the popliteal space just lateral to the midplane. Generally, this pulse is felt most conveniently with the patient in the supine position and examiner's hand encircling and supporting the knee from each side. The pulse is detected by pressing deeply into the popliteal space with the supporting fingertips. Since the complete relaxation of the muscle is essential to this examination, the patient should be asked to let the leg go limp and to allow the examiner to provide all the support needed. Palpation of the posterior tibial artery. The posterior tibial artery lies just posterior to the medial malleolus, and it can be felt most radially by curling the fingers of the examining hand anteriorly around the ankle and indenting the soft tissue in the space between the medial malleolus and the Achilles tendon above the calcaneus. The thumb is applied to the opposite side of the ankle in grasping fashion to provide the stability. How do we feel or palpate the dorsalis pedes artery? The pedes artery is examined with the patient in the recumbent position and the ankle relaxed. The examiner stands at the foot of the examining table and places the fingertips across the dorsum of the forefoot near the ankle. The artery is palpated lateral to the extensor hallucis tendon against the navicular bone. This pulse is congenitally absent in approximately 10% of the individuals. How do we see the radial delay? Here we palpate both radial pulses simultaneously to detect any inequality in timing. This is known as, if there is inequality, we call it as a radial delay. The causes of the radial delay are it can be a normal anatomical variation. It is very common in thoracic inlet syndrome, for example, cervical rib, aneurysm of the aorta, pre-subclavian coarctation, supravalvular aortic stenosis, pulseless disease, peripheral embolism or atheromatous plaque, atherosclerosis of the aorta, pressure over the axillary artery by lymph nodes, iatrogenic like Blalock tossing shunt operation, pathology of Fallet, Takayasu disease, aortic arch aneurysm. These are the few conditions where we can see a radial delay. So we should always examine the patient's radial pulses simultaneously to detect any delay. Coming to radiofemoral delay, if the femoral pulse is appreciated at the same time as the radial pulse, the patient is said to have a radiofemoral delay. This is a sign of coarctation of aorta and it can rarely be seen in aortoarteritis. The common causes are coarctation of aorta, atherosclerosis of the aorta, thrombosis or embolism of the aorta, or aortoarteritis, though it is very rare. Giorgio Baglivi has said, "Let the young know they will never find a more interesting, more instructive book than the patient himself." With this, I conclude my today's topic. Keep learning. Thank you.